The following symptoms are for the patient to fill out. 0, 1, 2, or 3. Don't forget that 0 is none, 1 is mild, 2 is moderate, 3 is severe. A lot of your patients will be tired, sluggish, and lethargic. Dry hair and skin. Quite often the patient will say, you know what, I keep on putting cream on my arms, cream on my hands, and it never seems to be enough. Sleep more than usual. You should really be sleeping 8 hours and 10 minutes per day. If you are sleeping longer than that, that is a problem. Weaker muscles, your patient knows when the muscles are getting weak. Constant feeling of cold. Now this is in the fingers, you put your back of your hand on the tip of the nose, and their hands are cold. And quite often you find that they are wearing extra clothing to try and keep themselves warm. This is not normal. Frequent muscle cramps, that's fairly obvious. Quite often they call them a Charlie horse, and this also includes any cramping for female with her periods. Poorer memory, this is a big one. This is one of the brain ones. And a lot of people have trouble with their memory. More depressed, or the mood changes easily. Slower thinking. These are all brain, and the thinking slows down. So quite often a patient will have a pause of when they are thinking before they give an answer. Puffy eyes, that is the puffiness under the eyes. Is fairly easy to observe when you look at the patient. Difficulty with math, this is the brain. And quite often people say, but I've always been math ever since I was young. Well, that is thyroid. Hoarser or deeper voice is quite easy to pick up, but quite often we get the patient to give a little bit of a laugh, and you can hear that crispiness, the croak, as they laugh. Constipation, this is fairly common with people who are hypothyroid. Coarse hair or hair loss, you can actually either look at the hair or see the hair if it is coarse, or if they have any general thinning, especially around the temples or through the middle. Muscle joint pain, this is fairly common as well, especially in the knuckles and knees and toes. Low sex drive and impotence is for men, and the low sex drive is, do you initiate sex when the two of you are in bed, or do you say, or when your partner initiates sex, do you say, no thanks, I don't feel like it. Puffy hands and feet. You can do the finger test by simply trying your finger into the hands, or we asked, do you ever get difficulty in taking your ring off during the day or in the morning? Unsteady gait, this is bumping into things. This is very, very common. A person who is hypothyroid is unable to walk in a straight line. They either walk to the left or to the right. Or when they walk through a room, they bump into chairs and tables and doorways. Quite often they get so used to it that when they take their clothes off, they think, well, where did I get all these bruises on my thighs? That is unsteady gait. Gain weight easily. This is the 3 spare tires. Is particularly around the middle, from the hips up to under the breasts. And quite often they say, I've been dieting, I've been exercising, and that is true. You cannot lose that extra weight. The outer third of the eyebrows thin. That's a pretty easy thing to observe. The menses. Now, the menses should be 28 days, 28 days, 28 days. If the 29, it's a 1. If it's 30, it's a 2. Or 31, it's a 3. Or any other irregularities. The menses should last for 3 days. That is the main bleeding. A little bit of spotting and bleeding on each side, but 3 days is what we like to see. Carpal tunnel syndrome is pain in the wrists. Now, we then add up the scores,
and we should be 8 or less. That's this little number here. These are your numbers. If the patient scores more than 8, they have the symptoms and they have a problem. It may be attributed to thyroid or iodine or adrenals, and that is what we're going to determine.